Healthcare workforce. Currently, 65 million Americans live in communities where they cannot easily access a primary care provider, and an additional 16,500 practitioners are required to meet their needs. The Patient Protection and Affordable Care Act will address shortages in primary care and other areas of practice by making necessary investments in our nation's healthcare workforce. Specifically, the Patient Protection and Affordable Care Act will invest in the National Health Service Corps scholarship and loan repayment programs to expand the healthcare workforce. The bill also includes incentives for primary care practitioners and for providers to serve underserved areas. Transparency and program integrity. The Patient Protection and Affordable Care Act will provide consumers with information about physician ownership of hospitals and medical equipment, as well as nursing home ownership and other characteristics. The bill also includes provisions that will crack down on waste, fraud, and abuse in Medicare, Medicaid, CHIP, and private insurance. Finally, the Patient Protection and Affordable Care Act will establish a private, nonprofit entity to identify priorities for and provide for the conduct of comparative outcomes research. Improving access to innovative medical therapies. The Patient Protection and Affordable Care Act will establish a regulatory pathway for the FDA approval of biosimilar versions of previously licensed biological products. The Patient Protection and Affordable Care Act will also expand the scope of the existing 340B drug discount program so that patients at children's hospitals, cancer hospitals, rural hospitals, and in other underserved communities will have access to medicines at lower cost. Community living assistance services and supports. The Patient Protection and Affordable Care Act will make long-term supports and services more affordable for millions of Americans by providing a lifetime cash benefit that will help people with severe disabilities remain in their homes and communities. CLASS is a voluntary, self-funded insurance program provided through the workplace. For those whose employers participate, affordable premiums will be paid through payroll deductions. Participation by workers is entirely voluntary. The Congressional Budget Office confirms that the program, which has been revised from earlier versions, is actuarially sound. Revenue provisions. The Patient Protection and Affordable Care Act is fully paid for and reduces the deficit in the next 10 years and beyond. The revenue provisions in the bill focus on paying for reform within the healthcare system. This is accomplished by tightening current health tax incentives, collecting industry fees, and slightly increasing the Medicare hospital insurance tax for individuals who earn more than $200,000 and couples who earn more than $250,000. This increase will not only help fund healthcare reform, but, when combined with other provisions in the bill, will also extend the solvency of the Medicare Trust Fund by 9 years to 2026. The bill also includes a fee on insurance companies when they sell high-cost health insurance plans, designed to generate smarter, more cost-effective health coverage choices. Changes to healthcare tax incentives include capping FSA contributions, conforming definitions of deductible medical expenses, and changing penalties for HSA spending that is not devoted to healthcare. The industry fees reflect responsible contributions from industries who have long profited from healthcare and who will benefit from the expanded coverage of millions of additional Americans under healthcare reform. The bill also assesses a small excise tax on indoor tanning services. Together, these revenue provisions represent a balanced, responsible package of proposals that bend the healthcare cost curve by putting downward pressure on health spending.
Viewing complete. Congratulations, you have finished the video presentation for this program. If you would like to take this course for credit, please proceed to our quizzer by using the checkout form below. Quizzer, please complete our checkout process, found below, to gain access to our quizzer. Your payment is submitted securely, and you will receive an email receipt for your records. A passing grade of 70% or higher is required to earn CPE or Pennsylvania CLE credit. You may retake the quiz as many times as necessary until such a grade is attained.